Pandemics are messy. They are never just biomedical events, they're also social, cultural, political, and otherwise. They take on an everydayness that we need to attend to. My name is Dr. Penelope Ironstone. I'm an associate professor in the Department of Communication Studies and Cultural Studies, and I'm the current director of the MA in Cultural Analysis and Social Theory.
My name is Greg Bird. I am an associate professor in the Department of Sociology at Wilfrid Laurier University. I'm also a faculty member of the MA in Cultural Analysis and Social Theory program.
While we had many colleagues who said it was premature to be writing about the pandemic so early on when we couldn't see the full picture, it was something that we thought was really important to engage and to think about.
We're hearing from the media, we're hearing from governments, but intellectuals were relatively silent around it, other than experts within epidemiology. We're dealing with charts and data, and we're looking at the numbers of people who have it. We're dealing with these things called curves and trying to flatten them. But where are the social scientists in this? Where are the philosophers? Where are the humanities people to speak about other adverse effects of these ways of thinking and these processes on people?
The first volume is actually filled with that uncertainty and anxiety and fear, but also with sort of really hope that we would be able to form new ways of thinking about and talking about our relationships to one another. Hope that this crisis moment would be an opportunity for us to learn some things, including learning about different kinds of inequality and who gets included in a conversation and who doesn't. The interesting thing is that the second volume is not painted with so much promise and hope for the future. It was produced after 40 days, the period of quarantine, with the idea that we would come back and do the second snapshot because so much had changed and there was more opportunity to reflect. And those reflections and reckonings with the pandemic turn into something very different. How do we get that understanding of the messiness and of the ways that we're all implicated, albeit differently, in the realities of the pandemic? How do we get all of those things on the table? Engaging those social science and humanities experts becomes a way of really opening up the conversation and thinking about the broader implications of the ways that we've organized ourselves in response to a crisis.
And we're not going to get this conversation for many of the biomedical field. Some doctors have been saying this. It should give us a moment to pause and look at how we've organized our lives and how we've organized our world.